The oncologist's office smelled like antiseptic and fear. I sat across from Dr. Elena Vasquez, 26 years old, listening to words that would change everything. Stage 2 ovarian cancer. We need to operate within 2 weeks, followed by aggressive chemotherapy. My hands shook as I pulled out my phone to call my parents. Dad answered on the third ring, his voice carrying that distracted tone he used when I interrupted his work. "Emma, I'm in a budget meeting. Make it quick." "Dad, I have cancer. Ovarian cancer. I need surgery in 2 weeks." Silence. Then, "Cancer? Are you sure? You're only 26. Doctors love to overdiagnose these days for the insurance money." "Dad, Dr. Vasquez is one of the top oncologists at Northwestern Memorial." "Northwestern? That's where your mother and I work. Emma. Don't you think we'd know if this was serious?" He was the hospital's chief financial officer. Mom headed the surgical nursing staff. "Look, get a second opinion. You've always been a bit of a hypochondriac. Remember when you thought you had appendicitis and it was just gas? I was 12 then. And it had been appendicitis. They just waited 3 days to believe me. Dr. Vasquez showed me the imaging. The tumor is. I have to go. We'll talk about this at Sunday dinner. Don't mention it to your grandmother, she worries." The line went dead. Dr. Vasquez looked at me with careful sympathy. "Family support is crucial for cancer treatment outcomes. Do you have someone else you can call?" I thought of my sister Rachel, the golden child finishing her MBA at Kellogg. I thought of my parents' pristine Lincoln Park home, the family dinners where my achievements as a nonprofit program director were barely acknowledged while Rachel's corporate internships were celebrated for hours. "I'll figure it out," I said quietly. Sunday dinner was at their house as always. Rachel arrived with her fiancé, both dressed in business casual, fresh from some networking brunch. I sat at the table in jeans and a sweater trying to find the words. "So, about what I told you on the phone, Dad." "Oh, Emma's cancer scare." He waved his fork dismissively. "Your mother and I discussed it. You're being dramatic. Ovarian issues are common in young women. Probably just cysts." Mom nodded, refilling Rachel's wine glass. I checked with the surgical team. Dr. Vasquez is known for being overly cautious. She probably wants to do exploratory surgery to pad her numbers. "It's not exploratory. There's a tumor. Stage 2 cancer. I need surgery and chemotherapy." Rachel exchanged a look with Mom. "Emma, you've always been the sensitive one. Remember your anxiety attacks in college? Sometimes stress manifests as physical symptoms. I have imaging. Blood work. The 125 levels that are. See, the 125 can be elevated for lots of reasons," Mom interrupted, her nursing authority settling over the table. "Endometriosis, menstruation stress. You're catastrophizing again." Dad leaned back in his chair. "Here's what we'll do. Cancel the surgery. It's just routine anyway. Get a second opinion from someone less aggressive. Your mother can recommend someone sensible." Dr. Vasquez said waiting could let it spread. "Emma." Dad's voice hardened. "Your mother has been a surgical nurse for 23 years. I think she knows more than you do about medical necessity. This sounds like attention-seeking behavior and frankly we don't have time for it. Rachel's engagement party is in 3 weeks, and we need you focused on helping, not spiraling about routine medical procedures." I left before dessert. The surgery happened 2 weeks later. My coworker Priya took 3 days off to stay with me. My boss, Marcus, visited with flowers and reassured me my job was secure. My parents sent a text, "Hope your procedure goes well. See you at Rachel's party." The tumor was larger than the imaging showed. Dr. Vasquez removed it along with one ovary and my appendix, where cancer cells had already spread. Stage 3, not stage 2. The pathology was aggressive. "You'll need 6 months of chemotherapy," Dr. Vasquez explained in my recovery room. "The delay cost us. If we'd operated when I first recommended, we might have caught it before metastasis." Priya squeezed my hand. My parents didn't call. Rachel's engagement party was everything Mom had dreamed. String quartet, champagne tower, Chicago's nonprofit elite mingling on a yacht. I arrived pale and weak 3 days post-op, incisions still bandaged under my dress. Mom pulled me aside immediately. "You look terrible. Can you at least smile? This is Rachel's night." "Mom, I just had cancer surgery." Oh, stop being dramatic. You had routine surgery. The way you're acting, people will think something's actually wrong. She thrust a champagne flute at me. Here. Circulate. Network. Try to make yourself useful for once. I watched her work the room, introducing Rachel to foundation directors and corporate donors. My father held court near the bar, laughing about hospital politics with board members. Neither mentioned my surgery. Neither asked how I felt. But I noticed Dr. Vasquez across the deck, deep in conversation with a silver-haired man I recognized from hospital newsletters. Dr. James Chin, incoming chief medical officer. Northwestern was undergoing a major management transition. New leadership. New priorities. Dr. Vasquez caught my eye and walked over. Emma. You shouldn't be here. You need rest. My family insisted. Her jaw tightened. The family that called your stage 3 cancer routine surgery and attention-seeking? The silver-haired man appeared beside her. Dr. Vasquez, introduce me to your patient. Dr. Chin, this is Emma Patterson. The ovarian cancer case I mentioned. The one where family dismissal delayed treatment and caused metastasis. Dr. Chen's expression sharpened. Patterson? As in Richard Patterson, our CFO? Hi, father, I said quietly. And your mother is? Linda Patterson. Head of surgical nursing. Dr. Chen's eyes moved across the yacht to where my parents were networking, laughing, celebrating. The parents who called stage 3 cancer routine and recommended canceling medically necessary surgery? They don't believe it's serious. They think I'm being dramatic. Dr. Chen pulled out his phone, typed something, then looked at Dr. Vasquez. Send me the full medical file. Patient consent permitting. I nodded. You have my consent. What I didn't tell my parents, what they'd never bothered to ask about, was that my work in nonprofit healthcare had connected me with the board members overseeing Northwestern's management transition. I'd been consulting on community health initiatives for the new leadership team. My name was already familiar to Dr. Chin and the incoming executives. 2 days later, I received an email from Northwestern's new chief strategy officer, someone I'd worked with on a healthcare access project last year. Emma, Dr. Chin shared your situation. We'd like to discuss a position on our patient advocacy board when you've recovered. Your insights would be invaluable. The chemotherapy started 3 weeks later. Priya organized a rotation of friends to drive me to appointments. Marcus adjusted my work schedule. My parents called once to complain that I'd missed Rachel's bridal shower. You're being selfish, Emma, Mom said. It's just a few hours of feeling sick. Rachel needs her sister there. I'm in chemotherapy for stage 3 cancer. You're milking this for attention. I've seen real cancer patients. They push through. I hung up. The hospital management transition happened in October, 4 months into my treatment. Dr. Chin took over as CMO. 3 new executives joined the leadership team, all people I'd worked with through nonprofit partnerships, all people who knew my story. The email arrived on a Tuesday. Northwestern Memorial Hospital Board meeting November 15th. Patient Advocacy Initiative presentation. Emma Patterson, consultant. My parents would be there. All senior staff attended board meetings. I showed up in a wig, still weak from my last chemo round, but steadier than I'd been in months. The boardroom filled with hospital executives, department heads, board members. Mom and Dad sat near the front, Dad's expression bored, Mom checking her phone. Neither noticed me slip into a seat near the back. Dr. Chin opened the meeting. Today we're discussing a new initiative, patient-centered care and family support protocols. We've identified concerning gaps in how we handle serious diagnoses, particularly when families minimize or dismiss medical recommendations. Dad shifted in his seat. We have a case study, Dr. Chin continued. A 26-year-old patient diagnosed with stage 2 ovarian cancer. The treating oncologist recommended immediate surgery. The patient's family, both of whom work at this hospital in senior positions, called it routine, suggested canceling the surgery, and accused the patient of attention-seeking behavior. Mom's head snapped up. Due to family pressure and dismissal, treatment was delayed. The cancer progressed to stage 3 with metastasis. What should have been a straightforward surgery became a fight for this patient's life. The room went silent. I saw Mom's face drain of color as she realized what was happening. The patient's mother, a senior surgical nurse, told her daughter that the oncologist was overly cautious and padding numbers. The patient's father, our CFO, said the patient was being dramatic and suggested it was psychosomatic stress. Dr. Chen's voice hardened. Both parents work here. Both should have known better. Both nearly cost their daughter her life. Dad was staring straight ahead, frozen. I'd like to introduce our new patient advocacy board consultant, who will be helping us develop protocols to prevent this kind of family medical neglect. Dr. Chen gestured to the back of the room. Emma Patterson. Every head turned. Mom's mouth opened in shock. Dad's face flushed dark red. I walked to the front, passing their table. Mom reached for my arm. Emma, wait. I kept walking. I stood at the podium facing a room full of doctors. My parents told me I was seeking attention when I had cancer, I said. They told me to cancel my surgery. Called my stage 3 diagnosis routine. Said I was being dramatic. My voice was calm. I'm alive because I ignored them and listened to my doctor. But how many people don't? How many die because family members with just enough medical knowledge convince them to delay treatment? My talk lasted 30 minutes. I explained new policies, family education, patient advocates, better communication. The board asked questions. Some praised my work. My parents sat silent, shrinking as their co-workers stared. Afterward, Dr. Chen called them over. Linda, Richard, my office. Now. I didn't stay. But I later heard the results. Mom was removed from her nursing leadership role. Dad was investigated for letting personal bias affect hospital decisions. The hospital made its message clear. Patient care came first. Anyone who ignored real illness, family or not, had no place making medical choices. 2 days later, my sister Rachel called, furious. Emma, what the hell? Mom's been demoted. Dad might lose his job. You're ruining this family. Rachel, I had cancer. They told me to cancel my surgery. They were trying to protect you. It wasn't unnecessary. I almost died because they delayed my treatment. You're being cruel. Mom's crying, Dad's in therapy, and the wedding's ruined. Your wedding means more to you than my life. Got it. I hung up. By December, I finished my last chemo session. Priya brought balloons. Marcus brought my team. Dr. Vasquez hugged me. You're going to make it. My parents texted, we'd like to repair our relationship. I deleted it. 3 months later, I joined Northwestern's Patient Advocacy Board. We added new rules, family education for serious diagnoses, assigned advocates, and reviews when families pressured patients to refuse care. Dr. Chin shared results. Faster treatments, better support, lives saved. This came from Emma's story, he said. Sometimes the worst pain teaches us the most. My parents reached out twice more, saying they were sorry. But their regret only came after they faced consequences. That wasn't real understanding. By spring I was cancer-free. Dr. Vasquez called it a miracle. I called it teamwork. Priya driving me, Marcus protecting my job, my doctor fighting for me when my own family wouldn't. A year later, I became Northwestern's Director of Patient Advocacy. Full-time. 6-figure salary. I now outranked my mother and reported above my father's department. They sent flowers. The card said, "We're proud of you." I threw them away. Because I'd learned something important. Some families only value you when they can't ignore you anymore. By then you've already learned to live without them. 2 years cancer-free now. Stronger than ever. Not just because I survived cancer, but because I finally stopped needing people who couldn't care enough to keep me alive.